was seeing patients on clinical service, I started to see a lot of infections, bacterial infections that weren't able to be treated with common drugs anymore, so common antibiotics, which are the drugs that we use to treat bacterial infections. So I became really interested in why that's happening and ways to prevent that. I am particularly interested in gathering data around how veterinarians use medications to treat animals. I'm working on a project in which we pull together medical records. Most of those medical records now in veterinary medicine are electronic, just like when you go to the doctor, they're entering all your height and weight information and your blood pressure into a computer. But that data is sitting in those veterinary hospitals. And so what I'm working on is a way to access all of that information so that we can put it together and really learn a lot more about what diseases we're seeing in cats and dogs, how those diseases are being treated, what preventative care is being used, what are risk factors for diseases, what are outcomes of those diseases, both with and without standard treatment. But the answers are kind of locked in the medical records at each of these veterinary hospitals, and so I'm working to pull those together so we can really examine them. It's really hard to enroll, say, 1 million cats or dogs in a study, but 1 million cats and dogs are being seen every day at veterinary practices, so at primary care clinics. And if we can access that data, we can say a lot more about what's really happening in those animals and in those populations.